Welcome to the deep dive. Today, we're taking a closer look, really digging into something specific in veterinary medicine, bile duct carcinoma in dogs and cats.
Mhm.
We've pulled together some detailed medical info to, explore this cancer affecting the biliary system and gallbladder.
Right. It's a really significant issue for pets, even if it doesn't maybe get the everyday headlines.
Exactly. So, our mission here is really to pull out the key stuff, the crucial information to help us all get a better handle on it.
Yeah, definitely. Bile duct carcinoma. It might sound a bit obscure, but it's a real concern. Basically, it's a cancer that starts from the cells lining the bile ducts,
Or the gallbladder.
or the gallbladder itself, yeah, the
Or-
epithelial cells there.
Okay, so just to get a picture, how often are we actually seeing this in pets? Is it rare? Common.
Well, in dogs, it's actually the second most common malignant tumor found in the liver.
Second. Wow.
Yeah, the numbers are somewhere between like 22 and 41% of those malignant liver tumors.
Okay. And cats.
In cats, interestingly, it's the most common malignant tumor in the whole hepatobiliary system, so liver and bile ducts combined.
Most common.
But, and this is important, cats are actually more likely to get benign growths in that area, things called biliary cystadenomas.
Ah, okay. And the reading mentioned those benign ones can sometimes turn bad.
Exactly. They have the potential to become malignant, transforming into what's called cystadenocarcinomas. So something to watch.
Definitely. And if it is malignant and spreads, where does it typically go? Metastasis sites.
The most common places are the lungs, the nearby lymph nodes,
Okay, lungs, lymph nodes.
and the peritoneum, which
Blech.
is the lining of the abdomen. If it spreads widely there, that's called carcinomatosis.
Sounds serious.
It is. And beyond those, the texts mention it can potentially spread to lots of other places too: intestines, pancreas, heart, spleen, kidneys, even the spinal cord, bladder, or bone. It can really get around.
That's quite a list. It paints a picture of something pretty invasive.
Mhm.
Now, the info also brought up something kind of unusual in cats, perineoplastic alopecia.
Oh, yeah. That's a fascinating and quite strange connection. Perineoplastic alopecia. It's where cats with certain internal cancers, including this one, develop this weird symmetrical hair loss.
Symmetrical hair loss. Not from the tumor itself touching the skin.
No, that's the odd thing. It's not direct invasion. The theory is the tumor releases substances, chemicals, that mess with the normal hair growth cycle. Really unusual.
Huh. Wild. Okay, so let's talk about who gets this. Does it affect certain types of pets more than others?
Well, we see it in both dogs and cats, as we've said. For dogs, there might be a bit of a breed link to now. Labrador retrievers seem to pop up in the data.
Labs. Okay. Any other factors?
Age is a big one. It's typically a disease of older animals, over 10 years old usually.
Makes sense.
And maybe, just maybe, a slight lean towards female dogs being affected more often, but the evidence on that is suggestive, not definitive.
So an older female lab might be statistically at a slightly higher risk.
Got it.
What should an owner be looking out for? What are the signs?
The signs reported by owners, the history, can be pretty general, unfortunately. Things like not eating well, being really tired or lethargic.
Just generally unwell.
Yeah, weight loss, maybe vomiting. Sometimes you'll see them drinking and peeing a lot more. That's polydipsia and polyuria.
Okay.
And then more specific signs could be jaundice, that yellowish tinge you see on the gums or skin, or maybe the abdomen looks swollen or distended.
And what about when they get to the vet? What might the vet find on an exam?
The vet might feel an enlarged liver, maybe even a distinct mass in the abdomen. They could also find fluid buildup in the belly, that's ascites, or confirm the jaundice, the icterus.
Okay. Let's shift a bit to causes. Do we know what causes it, or are there risk factors?
It's tricky. There is an interesting potential link noted in dogs between cholangiocarcinoma, which is a type of this cancer, and infection with certain parasitic worms,
Worms. Like what kind?
specifically trematodes like hookworms and whipworms. The connection isn't fully mapped out, but it suggests that maybe chronic inflammation from these parasites could play a role.
Huh. That's interesting. Anything else?
Well, not really a natural cause, but the source material did mention that scientists have actually induced this type of cancer in dogs in lab settings using a specific chemical. For research purposes, obviously.
Right. But the parasite link definitely highlights why regular deworming is important.
Absolutely.
So if a vet suspects this, what else could it be? What's on the differential diagnosis list?
Good question. Based just on how it looks on imaging, or even if they see it during surgery, there's a lot. It could be other liver tumors, both benign like adenomas and malignant like hepatocellular carcinoma.
So other liver cancers.
Right. And other biliary tumors too, like those benign cystadenomas we mentioned, but also non-cancerous things like nodular hyperplasia, cirrhosis, chronic hepatitis, even abscesses or rarer things. The list is pretty long.
So how do you get the definitive answer?
Ultimately, it comes down to histopathology. You need a tissue sample examined under a microscope.
Makes sense. And at that microscopic level, how do they tell this apart from, say, a cancer of the main liver cells, the hepatocytes?
That's where specialized techniques come in, particularly immunohistochemistry. They use stains to look for specific protein markers.
Like what?
Things like hepatocyte paraffin 1 or claudin 7. Finding or not finding these markers helps pinpoint whether the cancer cells started in the bile ducts or the hepatocytes. It's pretty clever.
It sounds like it. Okay, what about blood work and urine tests? What do those typically show? CBC, biochem?
You often see things like anemia, low red blood cells, and sometimes leukocytosis, high white blood cells, maybe indicating inflammation or stress.
Okay.
And almost always you'll see elevations in the liver enzymes on the biochemistry panel, ALP, GGT, ALT, AST, those key liver values.
But those aren't specific just to this cancer.
Exactly. They tell you the liver's unhappy, but not necessarily why. Lots of liver issues cause enzyme elevations. You might also see high bilirubin levels, hyperbilirubinemia, which causes the jaundice.
Are there any other lab tests that are particularly helpful here?
Yeah, one test mentioned is measuring WOCU fetoprotein levels in dogs.
Alpha fetoprotein.
Yep. The source said it's elevated in about 55% of dogs with this cancer, and it might help distinguish cancerous from non-cancerous liver problems. Potentially useful.
Interesting.
And critically, before doing any invasive stuff like biopsies or surgery, you absolutely need to check their blood clotting ability. A coagulation profile, PT and PTT tests.
Good point. Liver disease can affect clotting. Now, imaging. How do vets see what's going on inside? X-rays, ultrasound.
Standard X-rays. Abdominal radiographs might give you some clues. You might see a suggestion of a liver mass or secondary signs like the stomach being pushed out of place, or maybe the abdomen looks hazy because of fluid, the ascites.
But it's not the main tool.
Generally, ultrasound is much more useful here. Abdominal ultrasound lets you look directly at the liver, see the lesions, their location, what they look like, solid, cystic, whatever.
And it can do more.
Oh yeah, it's great for spotting that abdominal fluid. And you can even use the ultrasound to guide a needle to sample the fluid or biopsy the liver lesion itself. Very valuable.
And what about checking for spread, metastasis?
For that, chest x-rays, thoracic radiographs are really crucial. You need to check the lungs, as that's a really common place for it to spread.
Makes sense. What about fancier imaging, like CT or MRI?
They're definitely being used more and more in vet med, much like in human medicine. CT and MRI are more sensitive. They can pick up smaller lesions and sometimes maybe help differentiate tumor types better than ultrasound alone. They give a more detailed picture.
Okay, so imaging points to a problem. Now you need that tissue sample for the final diagnosis. How do you get it?
If there's fluid in the abdomen, the ascites, you can start with abdominocentesis, just putting a needle in and drawing off some fluid. Then you look at the cells in that fluid under a microscope. That's cytology. It might give you an answer.
But if not, or if there's no fluid?
Then you usually go for sampling the liver itself, typically guided by ultrasound. You can do a fine needle aspirate for cytology.
Just sucking up some cells.
Exactly. Or you can use a slightly larger needle to get a small core of tissue that's a needle core or true cut biopsy. That usually gives more architectural information.
And if those aren't enough?
Sometimes, yeah, you might need a bigger piece of tissue for a definitive diagnosis. That might mean laparoscopy keyhole surgery with a camera, or even a full open abdominal surgery, a laparotomy, to get a good biopsy sample.
Right. So once you have that tissue, what does the pathologist actually see? What confirms it's bile duct carcinoma?
Well, looking at the tissue grossly, like with the naked eye, these tumors can look different. They might be one big single mass that's the massive form,
Okay.
or they could be multiple smaller lumps scattered around the nodular form. Or it could be spread throughout the liver tissue more diffusely, the diffuse form.
Different patterns. Does location matter?
Yes. In dogs, it's most often inside the liver, intrahepatic. Less commonly, it's in the main bile ducts outside the liver, extrahepatic. And it's pretty rare for it to start right in the gallbladder.
And you mentioned benign versus malignant.
Yeah. A key difference often seen is that malignant ones tend to affect multiple liver lobes, whereas the benign tumors are more often just a single solitary lesion.
And under the microscope. The histology.
Microscopically, they classified them into subtypes. There's a solid type, usually called cholangiocarcinoma, and a cystic type called biliary cystadenocarcinoma. But interestingly, the source material suggests that knowing which subtype it is doesn't really change the expected outcome, the prognosis.
Huh. Okay, so we've got the diagnosis confirmed. What are the treatment options? What can be done?
The absolute best option, the preferred treatment, is surgery, if you can completely remove the tumor.
Complete removal, is that often possible?
It depends on the form. If it's a single massive tumor in one part of the liver, then yes, potentially. The liver has this incredible ability to regenerate. You can actually remove up to like 80% of the liver tissue if the rest is healthy.
Wow, 80%.
Yeah, it's amazing. But the problem is with those other forms, the nodular or diffuse types, you just can't surgically remove cancer that's spread throughout the liver like that. There's no effective surgical option then.
So what if surgery isn't possible? Any other approaches?
For some specific cases, like maybe a solitary tumor that can't be removed surgically for some reason, there are some interventional techniques being explored, like chemoembolization.
Chemoembolization, what's that?
It's where they deliver chemotherapy drugs directly into the blood vessels feeding the tumor, trying to target it specifically. It's more specialized, though.
What about standard chemotherapy, like 5V chemo? Does that work?
Unfortunately, the consensus from the sources is that, as of now, there isn't really an effective, established chemotherapy protocol that works reliably well for bile duct carcinoma in dogs or cats.
That's tough.
It is. And another important point about medication. You have to be really careful with any drug if the animal has liver dysfunction from the cancer, especially drugs that are processed by the liver or rely on that whole bile gut recirculation thing, the enterohepatic circulation. Things can get unpredictable.
Good point. So if surgery is done and hopefully successful, what happens next? What's the follow-up?
After surgery, you need really close monitoring. We're talking regular checkups, physical exams, repeating that blood work, especially the liver enzyme.
Checking for recurrence.
Exactly.
Yeah.
And repeat imaging. Abdominal ultrasound to look at the liver area, and chest x-rays to keep screening for lung metastasis. The usual recommendation is to do these checks roughly every 3 months, at least initially.
Okay, that makes sense. Is there anything owners can do to prevent this? Prevention strategies?
Well, based on that potential link we talked about in dogs with the trematode worms.
The hookworms and whipworms.
Yeah. It really reinforces the importance of good, consistent parasite control. Regular deworming, following your vet's advice on anthelmintic therapy, seems like a sensible step, at least for dogs.
Worth doing anyway. What about complications from the tumor itself? What can go wrong?
A couple of major concerns. With those big, massive tumors, there's a real risk they could rupture and cause serious internal bleeding, a hemorrhage. Definitely. And the other big one is biliary obstruction. If the tumor blocks the bile ducts, bile can't flow properly, leading to worsening liver problems and jaundice.
Right. So bringing it all together, what's the bottom line? What's the expected course, the prognosis?
Generally speaking, it's considered an aggressive cancer. The prognosis is often described as guarded to poor.
Especially if surgery isn't possible.
Exactly. If surgery isn't an option, the outlook is usually quite poor. And even with surgery, the rate of metastasis spread is really high in both dogs and cats. The sources cite numbers up to 88%.
They're high, wow.
Yeah. And in cats, that widespread seeding in the abdomen, the carcinomatosis, seems particularly common. The tough reality is that even after surgery that seems successful initially, many patients, unfortunately, succumb to the disease within about 6 months.
6 months.
Usually due to the tumor coming back locally or because metastasis develops elsewhere. It's a challenging one.
It certainly sounds like it. So, wrapping up our deep dive here, the key takeaways seem to be: bile duct carcinoma is a serious, often aggressive cancer in pets. Diagnosis isn't always straightforward, and the prognosis is frequently challenging. Early detection, if possible, is vital.
Absolutely. And understanding those potential risk factors, like the parasite link in dogs, is important too. It really highlights how complex these cancers are.
Yeah.
And it definitely shows there's a continuing need for more research to, find better ways to diagnose and treat it.
For sure. And that actually leads to a final thought to leave everyone with. Considering that link to parasites in dogs, it makes you wonder, doesn't it? What other things in their environment or maybe their lifestyle could be playing a role in this, or maybe even other cancers in our pets? It feels like there's still a lot to uncover there.
That's a great point. Definitely food for thought and future research.
Indeed. Well, thank you for joining us for this deep dive.